I'm going to start with a question I often ask schools when I'm sitting down and working with them, or large groups, and I ask them to look at their curriculum, their plans, the way they use their schedules as evidence. The question is this: what year are you actually preparing your students for?
I bet you, if you look back on your experience, you can think of many times in the classroom where a teacher said, "Do you remember last year when you studied this?" And you're going, "We didn't get to that." Or, "I'm going to introduce a new book to you," and you're going, "Hey, well, you read this 3 years ago." And those kinds of things happen all the time because there's been a confusion between a guideline and operational mapping, which asks us to make decisions with those maps. So it's a review process to review those maps and make better decisions on how to prepare learners. That's one level of work. Mapping is different from old forms of communicating about what curriculum is for a couple reasons. Mapping asks teachers to reveal what they're actually doing in real time operationally in the classroom the course of the school year and share it electronically with all other members of their faculty. It's authentic, and the reason is so that we can then make decisions about gaps, what we've left out, repetitions, to see if we're repeating things, are we aligning with standards that students need, and to just find out what the heck's going on in a building. You know, it may sound funny, but we're the only field, education's have been the only field that's been confused between what a guideline is and what's operational. If you were a doctor, you would be obliged to keep records in real time about precisely what care you gave a patient, what prescriptions you gave the patient, the state of the patient. And at the same time, you'd have guidelines. You could go to your shelf of books or go online and advise you, or find out what might help you with a decision. But you're not confused about those two things. You know the difference between guidelines, which are generic, and the actual patients you have. So you might have 10 patients that have a common condition. Say they all have some stomach pain. They're all different. You can make different prescriptions. They're different people. If I'm the next doctor who receives your patients, I need to know precisely what you did, what you worked on, what you assessed, how you assess them, what prescriptive actions you took in real time. In the past, Matt, we've never had that. All we've had in education were guidelines, and people made assumptions. Kids were actually experiencing certain things that they may or may not have. The other thing is, say you look at testing, for example, state testing or a portfolio of student work, and you go, gee, our kids seem to be having trouble with an area. Instead of just going, what do we do next? You can also work backwards, so to speak. So if you were an 8th grader, took an 8th grade math test, and we look through the 8th grade in your school and we go, my gosh, there's some problems here. The problems are cumulative. It's not really an 8th grade test. It's 8, 7, 6, 5, 4, 3, 2, 1, K. So we can go back and look at the maps and begin to say, we've left out things. There's some gaps here. Are we nailing this, or are we missing things? So that those who follow can have a better journey, as well as we're going to have to do something invasive right now because the 8th graders we have difficulties. So it allows you to do a lot of things. It allows you to, yes, have that history, but more importantly, take a hard look at what to do next, improve the journey of those who follow, update your work. One thing in medicine is you want to have current medications. You want to be right on the cutting edge of what is the most thoughtful, well-researched practices. And in schools, we have a lot of schools that are dated. When you look at your curriculum, you should aggressively, and I don't apologize for that adverb, you should aggressively be looking at what year you're preparing your kids for.